So this paper has been published 1 year ago, and it is freely available on the web. It is an open source paper. And the topic we are investigating with my friends, co-authors, is very important. It is about healthcare, and we all know that healthcare is a key issue. Somebody maybe forgot this, but the COVID-19 virus is going to remember to everybody the key issues of healthcare. And now I'm going to consider here in this investigation an infrastructural issue concerning long-term investments in hospitals. And especially we are going to talk about a smart hospital. What does it mean? Digitized hospitals, hospitals which are built with jump into high tech. Technology is a core issue. Which is the background of this study and why it is important for everybody? Because we all know that healthcare is a big industry. It is evolving, it is growing. People are getting older, and the expenses for healthcare are increasing all around the world. So this is a big sustainability issue. And we also know that in most countries, the backbone of healthcare is public. We have a national healthcare system. This is not the case in the US or in some other countries, but it is the case even in bordering places such as Mexico or Canada, continental Europe, most of even developing states in Central Africa or even in Asia. So there is a bulk of sustainability issues that refer to the public healthcare. And so our big question mark, the one that has inspired this kind of paper, is the following, and it is very simple. The public player wants to build up a new hospital, a technological one. Why? Because there is a need for new hospitals. Because if you build and run a new and good hospital and you are a public player, you can get new votes at the polls, because this is going to impact the industry a lot and the quality of life. But unfortunately, the public player misses budget money and technology experience. And this is why there is a need for a public-private partnership, an agreement, a joint venture between the public and the private. This is the case in most new hospital constructions. And that is why we're going to deal with this issue. Also, we may say, okay, so there is a relationship between the public and the private. The public is going to say, I want to build, let's say, a new healthcare infrastructure, a new hospital in a selected place. And we all know what is about the so-called NIMBY issues. NIMBY means not in my backyard. Nobody would love to have a nuclear power station in the backyard of his garden. Everybody's happy to have a nice hospital, a really good one, close to home. And so there is a social desire towards having good quality for care. And in healthcare, quality may be a synonym of survival. Low quality may bring to death. So it is a live or die issue, absolutely crucial for our very existence. So that is why there is a sort of partnership between the public and the private. The public is going to say, okay, I want to build a new hospital in a location that I have selected before, and then I make a tender between the private participants. In the European Union, if there is a big tender, then I have to invite all the countries from Europe. Can be Spanish, Italian, German, from Latvia or whatsoever. In other places, there is also a competition between big international players. And that is why this kind of competition between the private participants is going to bring up quality and to improve the value for money. Value for money is a price for quality ratio. So the public is going to say, okay, I want to establish a new hospital, and then there is a private tender. The private player may say, well, I'm going to introduce some new technological solutions to make the hospital smart, efficient, new, innovative, flexible, resilient, able to accommodate for new patients. And there is a model according to which big hospitals are going to concentrate on acute treatments when you need, for instance, surgery. And then you have a network where you're going to deal with normal cases. Let's make an example about the COVID that we all know, unfortunately. Everybody can stay at home to fix it, but if it becomes a big issue, then you go to the hospital. We are trying to avoid people from going to the hospital if it is possible. Having a good network between acute treatment, high quality centers, and the rest of the world, the outskirts, what is around the hospital. Also, a big issue that has inspired this kind of paper is the following. I just skip and go to some graphs that we're going to see together. So, the big issue is the following. The public wants the private to build a good hospital and to compete for this kind of tender and adjudication. But say, okay, remember, dear private participant, that there is little money left because there are big budget constraints. There is a big crisis, and so little money is left even for healthcare investments. And we do know that new technology is expensive, risky, and so it takes time and money. So if the public has no money, we may say, okay, no money, no party, game over. So which is the solution that we're going to look together to find a sort of compromise? The public player has little money. The private player, the private investor is going to say, okay, I might agree on a public-private partnership if there is some return earnings for me, if it is a profitable investment with a positive net present value for the project and for my equity holders. Otherwise, as a private player, I'm not going to participate to the game. So there is a sort of imbalance. We are all stuck in a big monetary issue, which is a possible solution. This solution is clearly exposed in our joint paper, and it is very simple. The private investor is going to take most of the technological risk to make the hospital smart, efficient, new, innovative, flexible, resilient. And this kind of new technology is sooner or later going to generate savings, important savings, and improvements of quality. And so there is a creation of a sort of value pie, a value cake. And this kind of new pie, new wealth creation is going to be partitioned between the public and the private players. So the public is going to say, okay, if you are the private investor and you can innovate the system, and this kind of innovation is going to make me save money because I can cure better the patients, then I'm going to give you some extra results, extra gains, extra remunerations. This is what we call pay for performance or results-based financing. This concept is very simple, and it has been introduced in healthcare more than 20 years ago. If jointly the public and the private create a sort of added value, a bigger pie, then they can share it. It is good news to share this extra value. And also we may say, okay, let's say that I am the private participant. I can take care of my international experience because I build many hospitals all around the world. I know how they work. I can give to the public player my expertise and just win the game and build and run a new hospital. Whenever there is a public and private partnership, normally it takes up to 3 years to project and build a hospital, and some from 20 to 25 years to manage or to run it as an operational phase. And the private player gets a financial economic return out of the public grant, public money that he gets for building, and then some earnings, some economic marginality to run the hospital. That is why the project can be profitable, can have a good value for money even for the private player, and that is why it can be bankable, affordable, because it is going to generate a positive outcome. Let's say that for a minute that the private player is going to exaggerate to get excessive rents because he can have a lot of savings that may not be fully disclosed to the public player. In this case, there is a private competition. If the kind of investment is too profitable, is excessive, then there's going to be a very tough competition to lower the price and to bring it back to a sort of equilibrium price. And also, we can have that in smart hospitals, and we go to figure 1 of this kind of presentation, we have an interaction among the public-private partnership stakeholders along the project finance supply chain. What does it mean, project finance? Project finance is often a companion of the public-private partnership, and it is a scheme according to which the private investor is going to build a new sustainable hospital, build it, as we said, in 3 years, and run it for some 25 years, and then it is going to pay back its debt towards the banks, not only using as a guarantee the assets, but using as a guarantee project financing the cash flows that it is going to generate. In other words, the private investors gets adjudicated the tender with the public tender issue, and then he gets money from the banks. He's going to generate a positive cash flows out of the building and the running of the hospital, and use a part of this cash flow to pay back the debt to the banks. Also, it is an orderly debt service that the private player, the special purpose vehicle that we see here in the chart, is going to guarantee to the sponsoring banks. So we have a sort of public-private partnership arrangement. The private player with the special purpose vehicle, with a holding company, also a management company, the sponsoring bank that support financially the private player, and the public procure, the private actor. The private investor with the SPV is going to guarantee some savings. Why? Because the hospital is technological. Because we can save money with new technologies. And is going to receive a remuneration in the form of results-based financing that we have quoted some minutes ago. So there is a win-win interaction between the private special purpose vehicle and the public procurer. Then we can have a link between the public and a key stakeholder, a key sustainable stakeholder, that is going to be represented by the patients. Patients are important. Hospitals and the healthcare system has to be built around the needs of the patient. And the key target, if possible, is, whenever possible, not always, to transform inpatients into outpatients and outpatient in home patients. What does it mean? Inpatient, I stay in the hospital, I sleep there, because I have surgery. In this case, I cannot avoid at all the hospital, unfortunately. But let's say that I am feeling a little better, even thanks to the technological upgrades. Then I can be transformed from an inpatient to an outpatient. I go to the day hospital and then I sleep at home. It is an improvement in the quality of life of the patients, and it is good savings for everybody, for the system. Then let's say that I can be transformed from an in or outpatient into a home patient. I get cured staying at home. Can I treat at home, for example, diabetes? Yes, unless I have to go to hospital for urgent and severe treatment. That is why we need e-health, mobile health, telemedicine that is linked to the big healthcare investment in the new hospital. Then patients are going to pay a toll. I pay for use. I go to the hospital, I have to pay a ticket, a contribution, or even taxes. And then there is a link from the public procurer, the patients, and also the private special purpose vehicle with the smart infrastructure, smart contraction, and smart management. Which is the link between a good construction and management? If I am the private player, if I am good at building a new hospital, it is cheaper and easier to run it. And I have a good relationship with suppliers, smart services, and contracts. Now we go quickly to the table because I have some few minutes left in my presentation. There are some risks that are going to change with smart hospital. The construction risk is going to change. We have innovation, new technology. Availability risk, what does it mean? I am the private investor. I have to make the hospital available to the public users. If it isn't, I don't get any remuneration. And even the availability risk is going to change. And also we can say, okay, let's go to the very end of it. We can have a sort of conclusion where we say this is going to be a public to private interaction. Technology is the big glue between them, and technology is also a sensitive issue, especially in healthcare, for sustainability. So telemedicine is also another technological innovation that is going to be very important. We can use also new technologies in healthcare like big data. Patients are going to give to the hospital, to the public or private players, data and information continuously. I get monitoring at home about my illness, my disease, for those who have diabetes. Each day they send a message with data, a number to the hospital through the digital platforms. So we can treat data in cloud. We can validate data information with healthcare blockchains that are very important. And then we can store data in the cloud and use artificial intelligence or machine learning to give an interpretation of the data patterns. This is going to init and produce a smart, innovative system, and everybody is going to benefit out of it. So this is the strong message, the simple also idea behind our joint paper. And this is mostly corresponding to the presentation of our paper that, as I said before, it is available for free to everybody. Okay, so this is the bulk of my presentation.